everyone. Welcome back to another episode of the Jane and Alex podcast. I am Jane, and I am so happy to be here with you today.
And I am Alex. It is great to see you all again. We hope you are having a fantastic week so far. Today, we have a very important topic to discuss.
Yes, it is a topic that is actually extremely useful. It might not be the most fun topic because nobody likes being sick, but it is necessary. Today, we are talking about English conversation at the hospital.
That is right, Jean. Going to the hospital or seeing a doctor can be stressful enough in your own language, but doing it in English, that can be very scary.
Oh, absolutely. I remember when I first started learning a new language, the idea of having to explain my health problems to a doctor was terrifying. What if I used the wrong word? What if they didn't understand where it hurt?
Exactly. That is why today we are going to break it down. We will go through everything step by step. We will talk about checking in, describing your symptoms, talking to the doctor, and even getting medicine. We want you to feel confident.
We want you to feel safe and prepared. So Alex, where should we start? Imagine we just walked into a hospital or a clinic.
Great place to start. The first thing you usually do is go to the reception desk. This is the check-in area. You need to tell them who you are and why you are there.
Okay, so if I have an appointment, what do I say? Do I just say, I am Jane?
You could, but it is better to be a complete sentence. A very common phrase is, "Hi, I have an appointment at 2 p.m."
Hi, I have an appointment at 2 p.m. That sounds simple enough. What if I don't have an appointment? What if it's an emergency or a walk-in clinic?
Good question. If you do not have an appointment, you can say, "I need to see a doctor, please." Or if it is urgent, you might say, "I would like to see a doctor as soon as possible."
Okay, I would like to see a doctor. That's polite and clear. What usually happens next? Do they just let you in?
Usually no. They will ask for your identification and insurance. They might say, "Can I see your ID and insurance card, please?"
Right, and then I would hand them over and say, here you go.
Exactly. Here you go. It is the perfect phrase for handing something to someone. After that, they might ask you to fill out some forms. They will say, "Please fill out these forms and sit in the waiting room."
Forms. I hate forms, but they are important. Okay, so we've checked in, we're sitting in the waiting room. Eventually, a nurse calls our name.
Yes, the nurse will usually take you to a room to check your vitals. Vitals are things like your temperature, your blood pressure, and your heart rate.
Okay, vitals. That is a good word to know. And the nurse will probably ask the most important question. What brings you here today? Or what seems to be the problem?
Yes, this is the moment where you need to describe your symptoms. Symptoms are the feelings you have that show you are sick, like pain, coughing, or a fever.
This is the hard part for many learners. How do we describe pain effectively? Because there are different kinds of pain.
That is true. Let's start with the basics. The most common structure is I have a plus the body part and the word ache.
Like headache.
Yes, I have a headache, or I have a stomach ache, or I have a backache.
Does that work for every body part? Can I say I have a leg ache?
Not really. That sounds a little unnatural. For body parts like legs, arms, or feet, we usually use the verb hurt. You would say, "My leg hurts."
My leg hurts. Okay, so I have a headache, but my leg hurts. What if the pain is really bad?
You can add words to describe the intensity. You can say, "My leg hurts a lot," or "I have a severe headache."
Severe. That is a good intermediate word. It means very, very bad. Severe.
Exactly. Another way to describe pain is to use adjectives like sharp or dull. A sharp pain is sudden and strong, like a knife. A dull pain is not as sharp, but it stays there for a long time.
Ouch, neither sounds pleasant. So I could say, I have a sharp pain in my chest?
Yes, and if you say that, they will probably see you very quickly. That is a serious symptom.
What about other symptoms? What if I feel hot?
If your body temperature is high, you say, "I have a fever." You don't usually say, "I have a hot temperature." You say, "I have a fever."
I have a fever. Got it. What if the room feels like it is spinning, like I might fall down?
That is called being dizzy. You would say, "I feel dizzy," or "I am feeling lightheaded."
I feel dizzy. Okay. And what if I ate something bad and I want to, throw up?
Well, you can say throw up, which is a phrasal verb, or the more formal medical word is vomit. But a very common way to say you feel like doing that is I feel nauseous.
Nauseous. That is a tricky word to pronounce. nauseous. So I feel nauseous means I feel sick to my stomach.
Correct. So let's review a few of those. I have a headache. My leg hurts. I feel dizzy. I feel nauseous.
Those are great. Now let's imagine the doctor comes in. Doctors often ask specific questions to understand the problem better. What might they ask?
A very common question is, how long have you had these symptoms? Or when did the pain start?
That is important. We need to be able to talk about time. I could say it started yesterday morning.
Or, I have felt this way for 3 days.
For 3 days. That is the present perfect tense, right? I have felt.
Yes, it means it started in the past and is still happening now. I have had this pain for a week.
The doctor might also ask, are you taking any medication?
Right, and you should list any medicine you take. Or if you have allergies, this is the time to say it. I am allergic to penicillin, for example.
I am allergic to. That is a life-saving phrase. Please memorize that one, everyone. I am allergic to peanuts or antibiotics.
Let's talk about the examination. The doctor may give you instructions. They might say, take a deep breath.
Take a deep breath. That means breathe in slowly and deeply. What else?
Open your mouth and say, ah. Or, does it hurt when I press here?
And I would answer, yes, it hurts. Or, no, that is okay.
Exactly. Simple answers are best. You don't need to use complicated grammar with the doctor. Just be clear.
Okay, Alex. I think it would be really helpful to hear this in a real conversation. Shall we try a role play?
That is a great idea. Let's do a role play. I will be the doctor, and Jane, you be the patient. You have come in because you have a bad flu.
Okay, I am ready. I am the patient.
Good morning. I see you are not feeling well today. What seems to be the problem?
Hi, doctor. Yeah, I feel terrible. I have a really bad headache and a sore throat.
I am sorry to hear that. How long have you had the sore throat?
It started about 2 days ago. It hurts when I swallow.
Okay. Do you have a fever?
I think so. I feel very hot and then cold. I have chills.
I see. And do you have a cough?
Yes, a little bit, especially at night.
All right. I am going to listen to your lungs. Please take a deep breath in and out. Good. One more time. Your lungs sound clear. It looks like you have a viral infection. I am going to prescribe some medicine to help with the symptoms.
Thank you, doctor. Do I need antibiotics?
No, antibiotics don't work on viruses. Just plenty of rest and fluids. Take this medicine twice a day with food.
Okay, twice a day with food. Thank you.
Great job, Jane. That was a very natural conversation.
Thanks. I noticed you used the word prescribe. I am going to prescribe some medicine.
Yes, a prescription is the paper or the digital note that the doctor gives you so you can buy specific medicine at the pharmacy. You can't buy strong medicine without a prescription.
Right. And you also said fluids, rest and fluids. Fluids just means liquids, right? Like water and juice?
Exactly. Doctors love the word fluids. It just means drink lots of water.
Now, Alex, I want to talk about some common mistakes learners make when talking about health. I hear people say things like, I have a pain in my head.
That is technically grammatically correct, but native speakers rarely say, I have a pain in my head. We almost always say, I have a headache.
Right. It sounds much more natural. What about the word sick versus ill?
Good question. In American English, sick is very common for everything. I feel sick. He is sick. In British English, ill is used a bit more often for more serious things, but both are understood everywhere. But be careful. Sometimes I feel sick specifically means I feel nauseous or I want to vomit.
Oh, really? So if I say I feel sick, people might think I am going to throw up?
Context is important. If you are holding your stomach and say, I feel sick, yes. If you are coughing and sneezing and say, I am sick, they will understand it is a cold or the flu.
That is a very helpful distinction. Another mistake I hear is confusing check and exam.
Yes, patients often say, I want a body check. In English, we usually call it a checkup or a physical exam. You go to the doctor for a checkup.
A checkup, that is the noun. I need a checkup. Okay, what about the pharmacy? After the doctor, we usually go to the pharmacy.
The pharmacy or the drugstore. When you go there, you give them your prescription. The pharmacist might ask, have you taken this medication before?
And they will explain the instructions. This is where listening is very important. They might say phrases like, take 1 pill every 4 hours.
Or take on an empty stomach. That means do not eat before taking it.
Or take with food. That means eat something first.
And they might warn you about side effects. Side effects are things that happen because of the medicine, like getting sleepy.
This medicine might cause drowsiness. Drowsiness means sleepiness.
Exactly. So if you hear that, don't drive your car.
Alex, let's talk about confidence. I think the biggest barrier is fear. Fear of not understanding.
You are right. But remember, doctors and nurses are there to help you. They want to understand you. If you don't understand something, it is completely okay to ask them to repeat it.
What is a polite way to ask a doctor to repeat something?
You can say, "I'm sorry, could you explain that again?" Or, "Could you speak a little slower, please? English is not my first language."
I think saying English is not my first language is actually very powerful. It lets the doctor know they need to be clear.
Absolutely. Most doctors will appreciate that honesty and will try to use simpler words.
Also, don't be afraid to take notes. If the doctor says a fancy medical word, write it down or ask them to write it down.
Yes, could you write that down for me is a great phrase.
Let's try one more short practice scenario. This time, let's do a more urgent situation. Maybe I cut my finger.
Okay, urgent care situation. Action.
Urgent, excuse me, I need help. I cut my finger while cooking and it won't stop bleeding.
Okay, let me take a look. Oh yes, that is a deep cut. Apply pressure here with this gauze. When did this happen?
Just now, about 10 minutes ago. It hurts a lot.
Okay, come with me immediately. We might need to give you a few stitches.
Stitches? Is that painful?
We will numb the area first so you won't feel it. Don't worry.
Okay, phew. Stitches, that is when they sew your skin back together, right?
Yes, stitches. S-T-I-T-C-H-E-S. Stitches. And numb the area means to give you medicine so you feel no pain in that spot.
Apply pressure. That means to push down on the wound. That is very common advice for bleeding.
Yes. So, we have covered a lot of ground today. We went from the reception desk to the exam room to the pharmacy and even a small emergency.
Let's recap the key points before we finish.
Sure. First, when checking in, state your purpose clearly. I have an appointment or I need to see a doctor.
Second, when describing symptoms, use I have a headache, stomach ache, or my body part hurts.
Third, be specific about time. It started yesterday or I have felt this way for 3 days.
Fourth, don't be afraid to ask for clarification. Could you repeat that or could you write that down?
And finally, remember vocabulary like prescription, fever, dizzy, and nauseous.
Learning these phrases now when you are healthy is the best way to prepare. You don't want to be looking up vocabulary words when you are actually sick and in pain.
That is such good advice, Jane. Preparation is key.
We hope this episode helps you feel more confident about having an English conversation at the hospital. It is a challenge, but you can do it.
Definitely. Listen to this episode a few times to practice the pronunciation. Try repeating the phrases out loud after us.
And stay healthy, everyone. We hope you don't need to use these phrases, but it is good to know them just in case.
Thanks for listening to the Jane and Alex podcast. See you next time.
Bye, everyone. Take care.